is postpartum hemorrhage?
Postpartum hemorrhage is when a pregnant woman that just delivered is bleeding after delivery. Several times, pregnant women died from postpartum hemorrhage because of lack of preparation. A lot of times we are already aware that these things happen, and you expect that somebody that is going to go through the process should have all the measures put in place before the delivery process itself will occur. But this is not the case in our society. A lot of people will prefer to have the case happen before doing something about it. There is no preparation. Another reason why these things happen is because most people, the birth attendants, the skilled birth attendants and the likes, they get carried away by the celebration. You know, new baby just arrived. Oh, this is where you want to bath the baby, you want to dress for the baby, you want to, you know, package the baby, make the baby look fine. By the time you are done, the woman is already bleeding, and by that time, it might even be too late to save the woman. So, getting carried away with the activities surrounding newborn most of the time puts the woman that just delivered in danger. Preventing postpartum hemorrhage is simple. Number one, let's prepare for it. Let's know that it can happen. Before going into labor, be prepared. Consult skilled birth attendants in order to get the preparation done by getting drugs ready, skills ready. Also, if there's anything that they will need like suturing material and the likes, they get everything ready before delivery. Another thing that we can do to ensure that we prevent postpartum hemorrhage is to ensure that there are skilled birth attendants available when you are delivering your baby. For instance, if a woman sustains cervical tear during delivery, if that attendant that is delivering the baby cannot identify or provide solution, you know that woman is in danger already. So not delivering with a skilled birth attendant is also a contributing factor. Another thing that we can use to prevent it is to ensure that the medication that can help the uterus to contract after delivery is available. It's available everywhere. It's easy to get. So if this medication is available, if there's anybody that the uterus is flabby and refusing to contract, thereby leading to bleeding, the person will be given the medication and the uterus will contract. So it's easy to control, but we just have to be prepared. Postpartum hemorrhage can happen to any pregnant woman. The factors that we are aware of, for instance, uterine atony, where the uterus that just delivered the baby is refusing to contract in order to reduce the bleeding. If it's not contracting, then it's not going to go back to its normal size. If it's not contracting, the area where the placenta just left will not close up. So that part where the placenta just left will be bleeding, thereby making the woman to waste blood. So somebody that is having flabby uterus that is not contracting can have postpartum hemorrhage. Somebody that there is a leftover of some part of the placenta, that person can have postpartum hemorrhage, because until the uterus is empty, until the womb is empty, the bleeding will not stop. So that's another factor. And somebody that is having coagulopathy, maybe there is a blood disorder, bleeding disorder in the family that also run in children, that person can bleed to death because the body will not be able to coagulate and control the bleeding easily. Another thing that can cause postpartum hemorrhage is trauma. When uterus ruptured unannounced, for instance, maybe from overstimulation from labor, that uterus is already having tear inside. So after delivering the baby, or even the person might not even make it to delivery of the baby. So trauma to the womb, trauma to the uterus can actually lead to uterine postpartum hemorrhage or even antepartum hemorrhage in this instance.
So why is postpartum hemorrhage still an issue in Nigeria?
One of the reasons why this is still an issue is because of the fact that people patronize community birth attendants more. As community birth attendants are even better. Some people will not even deliver with those community birth attendants. They will prefer their in-law or mother-in-law. You know, anybody that is elderly in our community, we believe the person can handle labor. Go and call mama, go and call mama. She's about to deliver, she's about to deliver. So we believe so much in elderly, as if they know everything. whether they are trained or not trained. We believe so much in our pastors' wives. We believe so much in our afar wives. We believe so much in our umu. So we believe that those people that are elderly, that have delivered 3 or 4, 5 children, they will be able to help other people that are entering labor, which is not the case. For me, I believe the reason why this is still an issue is because there's still a lot of gaps in our healthcare system that are making people not to patronize skilled birth attendants. One of the gaps that I can mention is lack of referral system. When a pregnant woman, for instance, just deliver in a primary healthcare center and you identify a problem that needs the assistance of a medical doctor, then you should be able to call an ambulance or call the next line of care. Or there should be we have comprehensive healthcare centers for each local government. Why can't those function to be able to help these women when they are delivering? There's just too much to actually talk about. For instance, why can't a skilled birth attendant in a primary healthcare center have medications that can help to reduce postpartum hemorrhage on ground? It's not just about having it, it should be on ground. It should be part of our emergency preparation for delivery for every pregnant woman. Our level of preparation for delivery is still low. So these are the things that we have to improve on to reduce postpartum hemorrhage. In the olden days, there might be medications, but people were not aware. But now we are aware and we have them available in pharmacies, in stores, and all that. So we know that there's help. And aside medication, there's skilled birth attendants now, where if there's tear, somebody can suture it. If there's retained placenta, somebody can pack it out and all that. Help is available. So there is progress, but we still need to do more.
What do you think still needs to be done?
We still have to go a long way. I think I should start from the fact that no pregnant woman wants to die. And no pregnant woman wants to lose her baby. So we should understand that. So whatever they need to do in order to prevent dying from postpartum hemorrhage, I'm sure they will be more than ready to do it. Now, let's start from encouraging them to patronize primary health care centers, skilled birth attendants. That's number one place to start from. Another thing that we can do in order to ensure that this postpartum hemorrhage is being tackled is to make available the medications needed. We can even make it a routine practice that anybody that just delivered should be given this medication. It's most of the time either cervically passed or intrarectally passed after delivery. It could be routine things so that we don't even have to be worried that somebody is going to bleed or not. We can do it routinely. Now, another thing that we can do is to ensure that we bridge the gap of national health insurance or even state health insurance so that people can come to the health facility without the burden of having to pay out of pocket. That will encourage a lot of people. The same way we are collecting money at the markets for tax or so, we can also encourage them to actually pay for health insurance. If we are really ready to put in the work, and they will do it, they can be encouraged. They do contributions almost every day. Those market women, they can do contributions the same way they can do health insurance if they can trust that the money is safe anyway. So we can help ourselves to ensure that we prevent bleeding after delivery.